Hi, this is MC of Healthy by George. Today we're going to discuss your cardiac risk factor. And I'm so excited because I'm going to be talking with Noel George, who is a longtime nurse practitioner who's my brother. Don't forget, subscribe, push that like button and the bell in case you want to know every Sunday and Thursday when we bring an episode to you. Welcome to Healthy by George. I want you to know that this is for informational purposes only, and it should not be considered as medical advice, nor does it have anything related to my employer. So it's always best for you to check with your own medical provider before you do anything that I recommend or for any medical treatments. So please join me, hit that subscribe button, and turn on notifications so you never miss an episode. Hey, Noel. So thank you for coming. I'm good.
Thank you for having me.
Excited to do this with you because, you know, cardiovascular disease is such a big deal. And in fact, recently we had some dear friends die suddenly in their sleep of a massive heart attack at a very young age.
So the number one killer.
It is. And one person was in their 40s, massive heart attack. Didn't know it. And then another person who, again, was working on weight loss like me and had a massive heart attack in their sleep. So one of the things I wanted to talk about is how do you really figure out your risk factors?
Well, there's a risk factor calculator in the 80s, actually late 70s, 80s. For many years, they did study after study, and it was with thousands and thousands of subjects. Mm-hmm. And they were trying to determine or predict what were some of the modifying and what were some of the permanent qualities that would indicate or at least give us some idea who was at risk. Mm-hmm. And over the years, they developed this ASCVD risk calculator.
So what does that stand for?
What it really helped the clinicians do is determine who was at higher risk, and that meant who was at a higher risk for having a stroke or a heart attack, and do you need to implement a change in medical therapy? Mm-hmm. And this formula was developed after studying hundreds of thousands of patients. I mean, hundreds of thousands.
Right.
And so they came up with a calculator to help the clinicians at least decide one thing now within the last 5 years, whether or not a person should be on aspirin or not. Mm. And that made a big deal. Just like the advent of automatic electronic defibrillators, the AED, at a heart attack or what's called sudden death episode. The event of giving a person an aspirin when they're having a heart attack can make or break whether or not a person continues to develop the clot in the area of vascular narrowing, whether it's in your brain or in your heart.
Wow.
And so this risk calculator kind of tells you in the next 10 years what your percentages are of your chances of having a heart attack or stroke.
Wow.
And if it is over 10%, they recommend taking a 81 milligram aspirin every day. At one point, they were putting everybody on aspirin when you were on a lipid-lowering agent.
Right.
And if you were on a lipid-lowering agent, they just automatically put you, but some people don't need it. And so because over the age of 60, and actually, it's not for everybody. It says estimate patient's 10-year risk factor initial. Also, they don't recommend aspirin for people over the age of 60, because of the fall risk.
Right.
But that's completely up to you and your primary care doctor or your cardiologist.
Right.
Because 81 milligrams of aspirin is being taken a lot by a lot of individuals at this time. And some people don't need to take it.
Really? Well, this is something new. Here it is. We have heart disease in our family. And I have not ever had any doctor say to me, let's figure out your risk factor. Not one.
Well, the problem is it should be done either with your primary care doctor or your cardiologist. And it should be done if you have a metabolic syndrome, and if you have several factors that could lead you to either have a heart attack or a stroke, it should be calculated with your primary care doctor.
So, but what are those risk factors? Like, I mean, for me, I'm already thinking.
There's 5 risk factors.
I have
your waist circumference over 40 inches.
Oh, over 40. Okay.
Mm-hmm. Your triglycerides elevated.
Okay.
Your blood pressure elevated.
Okay.
Hyperlipidemia or cholesterol being elevated.
Uh-huh.
And your blood sugar being up. Did I say blood sugar?
No.
There's 5 of them.
Okay.
If you have 3 of them or more, you have what's called metabolic syndrome.
Oh, wow. So we'll talk about that in another episode.
Okay.
Okay, so if I were going to figure out my risk factor, what do I need to think about? So what would be the number?
Well, first of all, how old are you, Mary Catherine?
65.
Are you at risk? Are you on a lipid-lowering agent?
No, I'm not on a lipid-lowering agent.
Do you have hypertension?
Yes, I do.
Are you? Do you have diabetes?
No, I don't.
Are you on treatment for diabetes?
No, I don't. I have treatment on polycystic ovarian disorder.
Okay. So we can calculate it. Yours might be low because we'll need some of the things that you need. You need your total cholesterol.
Okay, my total
cholesterol. You need your HDL cholesterol. You need your LDL cholesterol.
I have all that.
You need your blood pressure.
I got that.
You need whether or not you've ever smoked.
I got that.
Or if you're a current smoker.
Got that.
Whether or not you're on hypertensive or blood pressure treatment.
I have that.
Whether or not you're on a statin. And whether or not you do take aspirin.
Okay. So.
And we can even refine the risk factors from that point.
Okay. So what do I give you first?
Your age.
65.
65.
Okay. So
and it says please intervalue between 20 and 79 years old. So they do it up to 79 years of age.
Oh, wow.
You're a female.
Okay. Yep. I'm a female.
You consider yourself white, African American, other.
I mean, because we're Arabic. Does that mean anything, or should we just put in white?
It says these estimates may underestimate 10-year lifetime risk, but it's just warning because you picked other.
Oh.
What was your systolic blood pressure today?
So my 126 over 65.
So 126. Mm-hmm. And your diastolic?
65.
65. Everything's 65 today. And your total cholesterol?
So when it says total cholesterol, is that when it says just cholesterol or LDL?
Just total cholesterol or just cholesterol?
100.
It should say total cholesterol.
180.
180. And what is normal for your lab?
I don't know. Oh, you want the normal?
Less than 200?
Yeah.
Okay. And what was your HDL?
Oh, let me look at that. My HDL was 64.
64?
Mm-hmm.
Close to 65. And your LDL?
My LDL was 12.
12?
Yeah. It
Are you
says,
looking at the right thing?
well, it says LDL CHOLCALC.
No, that's not the right. So look for, it's a calculated value.
It says,
So you have to go down when it says total cholesterol, HDL, go down a little bit more. It's below triglyceride.
it says 100.
100?
Yeah.
That sounds more like it.
Okay.
And then you have a history of diabetes?
No. My hemoglobin A1C is 5.6.
And have you ever smoked?
No.
No.
Never smoked.
Are you on hypertensive treatment? No.
Yes.
Are you on a statin?
No.
Are you on any aspirin?
Yes, I am taking it ever
And
since.
why are you taking it?
Well, I had that incident with my vision. I had
Who told you to take it?
my neuro-ophthalmologist.
All right. So I'm going to put yes.
Mm-hmm.
And there's a red thing. Do you want to refine current risk factor? So it's actually giving you a risk factor of 4.8%, which is low.
Okay, 4.8.
So that means in the next 10 years,
okay,
you have, and what they consider optimal is 4% or less.
Oh, wow.
You have a 4.8% of having a heart attack.
So I'm borderline.
No, you're low risk.
I'm a low risk.
Mm-hmm.
So what would be a high risk?
High risk would be anything over 10%.
Okay, so anything over 10%. And if
so you want to do me?
Yeah, so, well, I mean, if you, well, let's just talk.
Let me refine it and see what happens.
Yeah, see what happens. Let's.
No, because it's like a.
Well, no, let me ask you something.
So.
This is what really worried me, because when Angel was alive, he had low everything except triglycerides. His triglycerides were through the roof.
Was he diabetic?
No. That was he had a history of, his mother had severe arthrosclerosis.
So let's just give me some numbers like you remember with Angel. He was how old?
He was 70.
Less than 70.
And
then he was male.
He was a male.
And he was Spanish, right?
He was.
And what was his blood pressures running?
His blood pressures were low. They weren't very high, so they were being
But he was on treatment, right?
He was on treatment. 140.
What was the last blood pressure?
I think it was 140 over 70 something.
All right.
But he always, whenever his primary care.
Do you remember any of his fat, lipids, cholesterol?
He had low cholesterol, but his triglycerides, Noel, were very, very high.
Yeah. So see, some of these actually do triglycerides. This one doesn't. This is American College of Cardiology.
Oh, really?
So what do you think you remember his total cholesterol being?
His total cholesterol was probably around 160, 180. I mean, I think his...
180.
Yeah, I think...
And then, do you remember what his HDL was at all?
No, not really. But I think, maybe 70.
Let's say 40.
Oh, okay.
5. And his LDL, bad cholesterol.
I think that would be probably around 105 or 110.
And then he did not have history of diabetes. He was a smoker at one point.
Nope, never smoked.
Never smoked.
But
he
drank.
was on blood pressure treatment.
He was on blood pressure treatment, and he did drink.
Was he on a cholesterol medicine?
No statins.
Okay.
But he did drink every day.
So something's wrong here. I'm missing something.
He drank every day.
Oh, forever. No. For some reason, don't want to calculate male. 70. I said apps should be used for primary prevention patients without atherosclerosis. It's primary prevention people without atherosclerosis.
So then, let's ask this. Let's say this. Okay, so you have this patient in front of you. How do we really think about reducing our risks if we are 10% or more?
Well, there's modifiable and non-modifiable risk factors.
So what are those?
So the non-modifiable are things like your race, your age, your sex,
right,
your genetic predisposition.
So like if you have family history of that.
Family history, yeah, that's a big one.
Yeah.
And some people have what's called familial hyperlipidemia, and they can't prevent that, but that's another risk factor.
Well,
so those are non-modifiable.
So that I think that was very big in his family, is that he had a history.
And unfortunately, the blood work we use is just looking for peripheral fats. It really doesn't separate it into intrinsic and extrinsic fat.
Oh, okay.
Which I wish they did, but it's very costly.
Yeah.
Even just to have a lipid profile is not cheap.
No, I know lipid profiles are expensive.
Especially if you're not really doing something about it. You just don't do a lipid profile because you want to.
So
you gotta be fasting.
There's
so many things that could actually mess up.
Really?
The testing part of it, because if they drink one sip of water, some people say it messes up everything.
Really?
However, the whole goal is to really alter or change or modify the modifiable.
And what are those
factors? Well, your weight,
Weight.
your blood pressure.
But how do you modify your blood pressure?
Well, blood pressure medicine.
Oh, but okay, so say you're taking a blood pressure medicine.
Well, here's the thing. If you lose weight, if you exercise, get your heart in shape, your blood pressure will follow.
But what does that mean about...
You need to be on medicine to modify it.
But how do I get my heart in shape?
You exercise.
So
it's like any muscle. It is a specific type of muscle, and it can get in shape just like your muscle in your bicep. But
so in other words, you need to kind of make yourself breathe and...
There are three things. When you have a metabolic syndrome, which we'll talk about later, one of the things that everybody recommends is move more.
Right.
Exercise more.
Right.
Do something. Move, exercise.
So get your heart rate up.
Well, it's not even, they don't even do that anymore, because what happens is people start shooting for goals that are not reachable.
Oh.
Okay. So now the recommendations are, how much exercise are you doing now?
So for me, I walk the dog 4 times a day.
Okay. Do you walk him further every day?
I will walk him 2 walks
Yes
out
or
of.
no, Your Honor? Yes or
So
no?
yes, I do walk further every day. A
So
little bit.
that's the whole thing.
Right.
They recommend, especially since everybody has smartphones,
Yeah.
they recommend you to look at your steps that you're taking and see how many you're taking just in general. They recommend a minimum of 10,000 steps a day.
Right.
Okay, now if you're not doing that, then they recommend you doing a little bit more. If you're already doing 10,000, and most people do close to 10,000 a day, just walking around, going to work, going home.
Yeah.
The problem is if you put your phone down and you don't have it on you, it doesn't actually record those steps.
I know.
But I noticed in general when I had my smartphone on me, I would do 6,000 to 10,000 steps a day.
That's good. But so that's your
here's the thing.
exercise.
If you do that as a baseline,
right,
you need to do more every day. So the recommendations are to do a little bit more every week.
So like 1 to 2%.
Pardon?
So let's say 1 to 2%.
I have patients that won't even do anything.
Really?
Well, they're not doing anything.
Oh.
They have a hard time They have a hard time quitting soft drinks.
Okay.
They have a hard time changing their diet to a low sodium, low sugar, low cholesterol diet. And so what I noticed is that if we made things very, very, very simple,
right,
and I saw them more frequently, their goals were met better. But you have to realize that by the time a person recognizes they have a metabolic syndrome or a problem
or risk,
they're in the thick of it. They have several factors. And that's what the problem with healthcare is. You got to stop this, you got to stop that. Well, guess what?
No.
They've been doing it for 20 years, 30 years. How are you just going to stop it all of a sudden like that? I can't even get people to stop drinking Coca-Cola and Pepsi.
I know, it's too severe, right?
Yeah, so you have to change the modifiable things. So they even recommend, if you cannot stop soft drinks, to start at least drinking diet soft drinks.
Right.
And then wean yourself into water.
Right.
And things like that. But they do recommend getting the high levels of carbohydrates out of your diet. So what happens is when we wake up in the morning, because all we've ever heard our life is eat every 2 hours, eat a big breakfast.
I know.
Well, guess what? That's wrong.
Exactly.
We need to eat
less
in pulses.
Yeah.
And we should not be grazing all day like we do.
No, I know.
Because we're constantly having a flood of insulin in your metabolic system. Yeah. And sooner or later, it just becomes desensitized.
So then basically the modifiables are your weight,
blood pressure, cholesterol, diet,
your diet,
exercise, lifestyle.
And then probably sleep.
Oh, sleep. You gotta sleep. Yep. Sleep's a big one.
Yeah. So if you're so basically you would start simple with whatever you felt.
Well, you have to actually do like kind of an inventory.
Okay.
What in my life can I change?
Right.
Or I'm willing to change? And how fast should I change it? Well, unfortunately, a lot of times people have a heart attack. That's when they have to change it.
I know.
Or a stroke.
Yeah.
Or like I saw a patient yesterday, he didn't have a heart attack, but he had 3 almost occlusive arteries, and so they did stents.
Oh dear.
And then they ended up having to do a bypass graft in surgery. So he got out of surgery, and here he is, 48 years old.
Oh my
open heart surgery, and now has to make these changes.
That's so young.
It's very young. And our society, because, not only America, but a lot of the other countries are following suit because our diets are so high in concentrated fructoses and sucroses and dextroses.
Yeah.
And our bodies don't know what to do with it.
Well, I don't think we realize what the damage is based on our diet. I really don't.
It starts at a younger age than what we're looking at. And since we don't even start seeing a doctor until we're 20 and 30, we really should start at 10 and 12 and assess. We used to actually, I don't know if you remember this, Mary Catherine, but they used to have physical education as a mandatory class in high school and junior high.
No.
Now it's an elective.
Yeah.
You don't even have to take physics.
It's not
you don't
mandatory.
have to even be in shape.
Yeah.
And you can leave high school with an obese condition.
I know.
I don't know if you remember that Jimmy Carter. I think it was Jimmy Carter.
I know.
That had the president's exercise. They were really good on
they made us.
Well, they did away with that.
Remember,
completely.
we had to run a certain distance. We had to do a certain
get away
number
with it completely.
Sit-ups and jumps and all that stuff. I remember that. Yeah, when we were in school. So I guess the key is that if you have family history and if you have anything that you're concerned about.
Well, one of the things that you're bringing to the population, one of the things you're trying to educate or enlighten people on is to assess their risk factors, assess their modifiable, non-modifiable risk factors. And if they do want to change it, they can change it and lower their risk factors of heart attack and stroke.
Listen,
if they're willing to change it, it's hard. It's not easy.
No,
because there's the market and our society is flooded with tons of information that some of it's accurate, some of it's inaccurate, some of it's hadn't done the research. So you can be bombarded or overwhelmed.
Yeah, it is
by
overwhelming.
What to do next. And it's almost like our primary care doctors don't have the time to tell us, well, really, you should do this next. I feel like this is the most important thing.
So if we
all we hear is lose weight, get your blood pressure under control, lose weight, lose weight.
Yeah. But I think if we really take home a couple of things from our discussion is find out what your risk factor is.
Right.
Be curious about that. And you can do that yourself.
Do an inventory.
Do an inventory of what's modifiable and not modifiable.
How much you're willing to change.
And then look at simply, like you said, if I'm...
Ask your doctor
what would
calculate your risk factor if you want to.
Yeah, that would be good because...
And it does open a door. That means that you're willing to take a chance at maybe changing your risk.
Yeah, and understanding what you can do about it. So... Well, this is
it's always hindsight. Our medical practice is always after the fact.
Well, I think we're trying in our medical dynamic to think more about wellness care because of all the people like myself doing a podcast, Dr. Attia and Dr. Huberman. There's so many podcasts out there who are focusing on healthcare and how we can get more proactive instead of reactive. So. Well, this is a great discussion. I know we want to talk about metabolic disorder in our next one, and I can't wait to do that again. I find our discussions so helpful. So I'm hoping that our audience will take that into consideration and calculate your cardiac risk. And we'll see you next time on Healthy by George. Don't forget to subscribe, click that like button, and ring the bell because we're here every Sunday and Thursday. Thank you. Bye-bye. So thank you so much for joining me at Healthy by George. I hope you found the information inspiring and that it encourages you on your wellness journey. Because remember, your body, your well-being are a most precious gift, and every tiny action taken daily can make a huge difference. I hope the information here is educational purposes and is not meant to replace your medical care. See your doctor and talk about what works for you. If you enjoyed today's content, don't forget to give it a thumbs up and subscribe to my channel. Your support means the world to me, and it helps me continuing creating content that inspires and empowers you to live your best life. Goodbye for now, and join me again at the next Healthy by George.